today we're back at Shine SA talking to Anne Stevens about contraceptive methods and sexual health. So let's go. Hi, I'm at Shine SA, and last week we talked about cervical cancer. This week we're about to have a bit of a chat with Dr. Anne Stevens, who works here at Shine SA in the clinical and medical areas, about contraception options and a bit about sexual health. So can you please explain to me what sort of contraception options are available for younger and older women?
So these days, Kate, there's a large number of choices. I'd really encourage people, if they're already on a contraceptive method that they're not happy with, to perhaps consider finding out about some of the other methods available rather than stopping contraception altogether.
Can you please show me a few of these contraceptive methods?
Sure. Probably one of the most commonly used contraceptive method is the pill, and as you can see, Kate, there's many different formulations with the pill. The pill is a combination of estrogen and progesterone, but there's also a progesterone only pill that many people aren't aware of that might be suitable for some women who can't tolerate the other combined pill. This little rod is the implant. It's a progesterone only method. It's got a progesterone hormone in it, and it's inserted under the skin in the arm, and it is effective for 3 years. So that's what we call a set and forget method, where it's put in and the woman actually doesn't have to rely on herself having to take a pill every day. One of the other forms of contraception that has become more popular recently is the intrauterine contraception. We've got a couple of different forms of that. There's a progesterone containing IUD and a copper containing IUD. And they involve an insertion being put into the uterus, and they're left for between 5 and 7 years. And the newest method of contraception is a vaginal delivery of the contraceptive pill. And so it's a combined hormonal method, so it's got the estrogen and the progesterone in it, and the woman inserts this into the vagina herself, leaves it in for 3 weeks, and it has similar effectiveness to the oral contraceptive pill. And the other thing that we like to really encourage particularly younger people, but particularly starting a new relationship, is the condom, which can be used as a backup to other methods of contraception. Its real advantage is protection against sexually transmitted infections. The other longer acting method of contraception that's a hormonal method, a progesterone method, is the injectable contraception, which is a once every 3 month injection of progesterone.
If you haven't used contraception or it's failed, what should you do?
Well, there is an option for contraception after intercourse, and that comes in the form of, nowadays, a progesterone only pill, which is 2 tablets that are taken at once, timed best to be taken as close as possible after intercourse, but it can be used up to 5 days after intercourse.
So Anne, what have we got here?
Well, we've got the model of the female internal organs and the equipment for taking a pap smear. The pap smear is collected from the cervix, which is the neck of the womb, which is at the top of the vagina. And to collect that pap smear, we actually need to see inside the vagina, and what we use to do that is this speculum. So the speculum is actually inserted gently into the vagina and then just opened a little bit for the person who's collecting the pap smear to be able to see down right into the vagina up to the cervix. And then once we've visualised the cervix, we can actually collect the sample, which is with a spatula that just rotated on the cervix and then wiped onto this glass slide. And this little soft brush just rotated once inside the opening of the cervix and then wiped onto the slide. Often at the same time we can use the opportunity to take a sample for infection, such as chlamydia, and those samples can then be sent away to the laboratory for analysis.
So today we've learned a whole lot from Anne, and really now it's up to you about what sort of method in contraception is the right choice for you, and also making sure you get those regular health checkups for sexual health. And just come right here to Shine SA, because they've got some great information and they're available anytime.